Good morning all of you. Today I'd like to teach you the correct technique of how to do a pupillary examination. And before you even attempt to do a pupillary exam, you need to have certain basic paraphernalia. Now the equipment that you need are two torches. A mag-light torch is preferred, but make sure that the torches have fresh batteries and the light is nice and strong. Because if you have two torches of varying intensity, then you will get different type of pupillary reaction when you use the torches. The second important thing is to have a stick like this, which has got a accommodative target on which the patient can fix. Now this is important, especially when we are checking the light near dissociation and when we are checking the pupillary reaction to a near object. Like you have the accommodation triad, which is convergence, accommodation and meiosis. Now even before you start with the examination in your chamber, it's always a good idea to initially examine the patient, not directly jump into examining the pupils. So before you even start the examination, the most important thing is to explain to the patient and obtain the consent for the examination. So you tell the patient that you have to examine the patient, that you will be throwing a bright light. I'll be throwing a bright light. So if you feel a little uncomfortable, you can let me know. So when I ask you to look at a certain distance, you keep looking at that same point. Okay? So this is the first step. So you get a consent and you have to explain the procedure to the patient before starting the examination. The examination, like I said, always starts with a basic inspection of the patient's face. Now why do we need this inspection? So the first thing you look for is facial symmetry. Now if there is gross facial asymmetry, then it could be due to a result of trauma, and that could produce a damage to any of the nerves like the oculomotor nerve, which can produce ptosis and pupillary abnormalities. Look for scars on the forehead, on the lids and also in the region of the neck. Now scars in the neck can affect the sympathetic ganglion, and when the sympathetic chain is cut because of surgery in and around the neck area, it can produce a Horner syndrome and also an abnormal pupillary reaction. The second thing that you have to notice is look for the presence of an obvious ptosis. In this patient there is no obvious ptosis, but look for obvious ptosis. So ptosis or drooping of the lid can occur in third nerve palsy, produces an efferent pupillary defect, or it can occur in Horner syndrome where the sympathetic chain is affected. Then look for the obvious squint. So if there is congestion around the eyes, it could be as a result of post-uveitis sequelae. Patient could be having posterior synechiae and therefore abnormal pupillary reaction. In addition, in the presence of active uveitis itself, the pupil will not react briskly to light. Then look for the presence of anisocoria and heterochronia. Now the reason why you need two torches is that if you want to observe both the pupils at the same time, okay, so you please look straight. So you start off by, if you want to examine the right pupillary reaction, you start off by standing to the right of the patient. Before you even start the pupillary exam, you must know what is the pupillary reflex pathway. You should know what is the afferent limb. You should know that the light, when it falls on the retina, travels via the visual pathway and splits off before the lateral geniculate body, goes to the midbrain and goes to the pretectal nucleus. So from the pretectal nucleus, there is a bilateral supply to both the Edinger-Westphal nucleus of the third nerve, which is the preganglionic parasympathetic supply to pupillary reaction. Then the parasympathetic pupillary fibers travel via the oculomotor or the third nerve. They reach the ciliary ganglion where the synapse, and the postganglionic parasympathetic fibers travel via the short posterior ciliary nerves and finally supply the sphincter pupil. So this is something you should know, and which is important in understanding what is known as the direct pupillary reflex and the consensual pupillary reflex or the indirect pupillary reflex. Now to check for consensual pupillary reflex, you should have a visual of both the pupils, and to do this, you shine the torch from below so that the torch bounces off the patient's nose so that both the pupils are visible at the time of examination. Pupillary exam should always be done under dim lighting conditions, because that is where the maximum changes in pupillary reaction can be observed. So can we dim the room light, please? Yeah. So we have dimmed the room light. Obviously I cannot dim it further because you won't be able to see what I'm doing. And so the first step is to make the patient fixate at a distant target. So if you are sitting in a consulting chamber, the best thing is to ask the patient to look at the Snellen's chart in front and to fixate at an object which is a 660 or a 636. So please look. Then you stand to the right of the patient. Please don't stand in front of the patient, because that way the patient will be forced to take fixation on you, and this will prevent the patient from looking at a distant target. So then you shine the light. So this is the beam of light. You can see it on the patient's cheek. Make sure that this beam of light falls only on the right pupil. Suppose you hold the torch further away, you see that the beam of light is covering the entire face, and therefore the light will fall in both pupils. So the first step for checking is to bring the torchlight close enough so that the beam of light falls only in the right pupil. Then you go close so that you can see the pupil, and then you have to bring the light quickly on top. It's too bright. So the beam of light, you move it up, and then you see that the pupil is constricting. So when you move the beam of light like this, you see the pupil is constricting. Now this is a direct light reflex. Now having checked the direct light reflex in the patient's right eye, we have to see what is the consensual reflex. The consensual reflex means, or the indirect light reflex means, that when light is shown in the right eye, the left pupil will constrict. The reason why this occurs is because there is a bilateral representation of pretectal nucleus to the Edinger-Westphal nucleus in the midbrain. That is the reason why. So this is a very important sign for us to differentiate between afferent and efferent pupillary defects. Simple test. So in this case, I'm going to demonstrate how to elicit the indirect light reflex. So the indirect light reflex, or the consensual light reflex of the right eye, you have to observe the pupillary reaction on the left eye. So for this, you again bounce the light on from below. So hold the torch below so that the light bounces off the patient's nose and both pupils are illuminated. Okay, and then you shine the light on the right pupil and see what happens to the left pupil. So when I shine light on the right pupil, the left pupil is also reacting equally, and this is known as a consensual reflex. Now, having finished the examination on the right side of the patient, you then need to repeat the examination for the left pupil, and for that we have to stand to the left of the patient. So do not try to perform left pupillary exam while standing on the right side of the patient. This is because the patient needs to fixate at a distant target. So once you are there, I'm running through the same procedure again. The torchlight falls on the pupil and you look at the pupillary reaction, and then the consensual light reflex. You bounce the light off the patient's nose and chin, so both pupils are illuminated. Shine the light on this eye and look for the pupillary reaction in the right eye. Now if the direct and the consensual reflex are brisk in both eyes, then we don't have to check further. That means both pupils are reacting briskly. So when you see a pupillary reaction, you have to quantify the reaction as brisk or sluggish. So when do we know that the pupillary reaction is brisk, and when do we know that the pupillary reaction is sluggish? So to know this, we have to notice two things, what is called the amplitude as well as the speed of contraction. So amplitude of contraction is a pupil which has a resting pupil size of say 6 millimeters. When you shine the light, it becomes 2 millimeters. So this is amplitude. So from 6 to 2, that's the amplitude of constriction, and the speed with which it constricts. It constricts very fast or it constricts slowly. So a brisk pupil is one which has a good amplitude and speed of constriction. Now the problem will come if one of the pupil is reacting sluggishly. So if one of the pupil is reacting sluggishly, then we have to use a complex interpretation of the direct and the consensual light reflex in order to find out whether the block is an afferent block involving optic nerve or the pathway, or it is an efferent block involving the third nerve or the oculomotor nerve. Now remember an important clue that when the patient has anisocoria, it can never be afferent pupillary defect. In afferent pupillary defect, there will not be any anisocoria. The presence of anisocoria usually indicates an efferent pupillary defect. This is because in afferent pupillary defect, since the afferent nerves go to the midbrain and since there is a bilateral decussation, the oculomotor nerve will always receive the same amount of impulses on both sides. Okay, so this is one clue. Now suppose the person has a sluggish pupillary reflex, then you have to check the near reflex as well. Let me show you how to check the near reflex. So for this, we need to use this is a stick which has got a accommodative target on it. So this test is performed by first explaining. When I ask you to look, you look at this. Otherwise you look straight. Okay? So now look straight. So what you do is you keep the target just below the patient's visual line, but make the patient to look at a distant target. You use this torchlight to illuminate both the pupils. Now look straight. Now look at the target. Look straight. Look at the target. So when she looks at the target, I can see that both the pupils are constricting, and this is the way you check the near light reflex. After which you have to ask the patient to look back at distance, and you have to quantify what is known as dilatation lag. So with this, we'll end this tutorial. In the next tutorial, I'll tell you about how to assess a case of anisocoria and how to actually interpret afferent and efferent pupillary defects. So this lecture has been simply to tell you how to go about performing pupillary examination.